Welcome to A Parent's Guide to Child Development. I'm your host, Anna-Marie Von Furley from Fledglings Flight. Each podcast, we strive to give parents the tools they need to help their child thrive through conversations with experts in child development and psychology, where you can learn about the most important information that you didn't know existed. If our last conversation with Emily Roper was a flyover of the entire primitive reflex landscape, today we're zooming all the way in on the two reflexes that may explain more about modern mental health than just about anything else: the fear paralysis reflex and the Moro reflex. These are the two reflexes that wire your child's earliest sense of safety, their stress response, and their ability to handle a world that, frankly, doesn't always feel safe. When they don't integrate the way that they're supposed to, the ripple effects can look like anxiety, sensory overwhelm, perfectionism, sleep struggles, panic attacks, allergies, and even chronic illness, sometimes decades later. I'm thrilled to have Emily Roper back with us, neurodevelopmental delay therapist, certified midwife assistant, and founder of Early Roots, and host of the Early Roots podcast. Emily, welcome back to the show.
Thank you. I'm so excited to be here again.
Oh, me too, me too. I'm still living off the excitement of our last conversation. So happy we get to dig back in, but go deeper this time.
Yeah, me too.
Fantastic. Of all the primitive reflexes we could do a deep dive into, why did you want to focus on fear paralysis and Moro together, and what makes those two so foundational to everything else?
Sure. So I really wanted to look at these because, well, first of all, it is probably the number one problem that I see in my practice. So it's the most common problem. It's the most common thing I see in the kids that I work with. And it seems to contribute to the symptoms that parents are concerned about more than anything, any other singular thing. So I really wanted to dive into these. And yeah, that's why. Um,
Um, Can you give us the big picture relationship between fear paralysis and Moro? People often hear that Moro replaces fear paralysis. What does that handoff actually look like?
Sure. So this is where we kind of get into more of the like theoretical side of this type of work. Because when we're looking at early reflexes, these intrauterine reflexes, so the fear paralysis is what we would call an intrauterine reflex. It's something that develops very early in pregnancy, around the first month or so, and it should disappear before babies are even born. So this is a reflex, and this is like a type of functioning and a system that we don't typically see outside of the womb, which makes it very difficult to study accurately, which means a lot of what we are looking at when we talk about these things, we're making educated guesses on. um, so the fear paralysis reflex is basically this, what we would call a whole body freeze or withdrawal reflex. So when the embryo is stimulated tactily, so like they're touched, what they'll do is kind of their whole body will pull back and withdraw, and then they will freeze. And this is a very interesting reflex because you only see it for this very short period of time. It is like on the evolutionary spectrum very early. Anytime we look at a freeze type response or reaction, we think of that as like a very developmentally early response to stress. It is like a very rudimentary reaction. It's not very dynamic. It's not very nuanced. It's very intense. That's kind of like our biggest, or that would be like the response that you see when you have the biggest reaction to threat, and you have the simplest and most basic survival response to that. So that's something you see early in pregnancy. And then as babies develop and mature and other parts of their brain develop, then you see more advanced reflexes come on board. So that's when the primitive reflexes start to develop. And those develop pretty early in pregnancy too. Within the first few months, you'll start to see the Moro develop. And the Moro is a little bit more complicated. It happens at the brainstem level, whereas the fear paralysis happens at the spinal cord. So it happens before the other parts of the brain have developed, when we're just like babies have a very, very basic nervous system. There's not a whole lot going on. So it's a very, very basic reflex. And then we have the Moro, which is a little bit more advanced, and that has some other connections to different parts of the body. It's regulated by the brainstem. It's one that babies should keep for the first several months after birth, and then that reflex should integrate. And what we should develop is a much more advanced dynamic adult startle response. And that one really is calibrated a lot based on your environment and your situation. And the like typical adult stress response will have a lot of different reactions depending on what's going on in the environment. So they go from very simple, um, like more intense to more dynamic, more complex and more dynamic as we develop. And so I wanted to look at the fear paralysis and the Moro because it is essentially looking at how our body responds to threat and danger. And it is the kind of physical testable signs of what's going on internally. So when we talk about primitive reflexes, I really actually don't care as much about the reflexes. The reflexes are just signs that the body has and the nervous system have not developed properly. They're just an easy way for us to test and say, "Oh, something is going on underneath." Um, and so when you look at things like the fear paralysis reflex, you look at the Moro, what we're really looking at and seeing is that this child's whole stress response, their whole threat detection system, their whole sense of safety is immature and underdeveloped and hypersensitive, and they're not responding to the world in a healthy, mature way. And that is really important for pretty much every area of functioning. Our sense of safety and our response to stress and our response to our environment affects every different area of well being. It affects our physical health, it affects our social emotional development, it affects our attention and our ability to regulate our body. It affects things like academics and learning and our ability to have impulse control and executive functioning. All of these other things are built first out of this sense of like safety and stability. That piece has to come first.
Hmm, that's interesting. You've described it as a deer in the headlights or playing possum response. Can you walk us through what that freeze response looks like in a baby versus a child versus an adult?
Yeah, so this is where it gets really tricky because we don't have standard testable norms for the fear paralysis reflex. We do for the Moro. We have like a lot of good testing to understand and see what the Moro reflex looks like at all these different stages. The fear paralysis is one that we are kind of guessing at because we barely have norms for what that looks like in utero, much less in like infants and then in older kids. So when I'm looking at it and I'm suspicious that that might be going on, what I am looking at is a child that goes into that type of freeze response. I'm looking for basically kind of a body shutdown. So, for example, like with the Moro, what you see sometimes is activation where they'll startle, they'll get like really aroused, you'll see their pupils dilate. Sometimes with kids though the opposite will happen. They'll almost shut down, their pupils will constrict, their breathing will slow down. They'll have kind of an under arousal response to something. But they look frozen and fearful. It's not like they're calm and relaxed. And anytime I see that type of intense freeze response, I'm suspicious that maybe there's a fear paralysis there. But really, what it's telling me is, ooh, this is a really, really intense response to whatever's happening. And most of the time, when I'm looking at it and testing it, it's like they're startled because I made a loud noise or I got too close or something that should not create this like deep sense of unsafety and panic. And so when I see that, it's hard because, like I said, we don't have good standard testable norms to say like this is exactly the fear paralysis. But what we can say is that is not a healthy, normal response for an 8-year-old child in the office. that
Right.
that that kiddo is not okay.
This reflex is supposed to integrate before birth. What are the in utero conditions that interfere with that? Maternal stress, anxiety, smoking, substances, domestic violence, lack of movement. And how does the mother's nervous system shape the babies?
Ooh, yes. So again, these are all things that are a little bit on the theoretical side. These are risk factors that we're looking at. So we can't really get cause and effect with these. What we get is a lot of correlation around what moms experience and then what we see with babies. What we do know from a lot of like testing and imaging studies is that moms that have chronic stress and that have kind of heightened aroused nervous systems, their baseline is higher. So they are more sensitive and more reactive to stress after birth. And we know that what mom's experiencing and what her body is doing is teaching baby how to function when they're born. So their nervous systems tend to mirror and match mom's, which makes complete sense. It's totally adaptive. If mom is healthy and functional and living in this world that baby's coming into, then yes, we expect if their nervous systems function similarly, then that baby's going to do great. That's just not always, unfortunately, the case that these kiddos wind up in. But when I'm looking for something like a fear paralysis reflex, when I see a child that has that intense of a stress response, what I expect and anticipate to see is something pretty significantly traumatic that happens early on in pregnancy before that reflex had a chance to develop. So, probably not something that's just as simple as mom's a little stressed out because she's working too hard. It would be something like mom had a really significant injury or there was like a threatened miscarriage, or there was like she's experiencing domestic violence, or she's literally living in a dangerous situation where she is not safe. So typically when I see something that's really intense, like a fear paralysis, I expect there to be a pretty significant trauma history that happened sometime prenatally. And trauma can come from things like maternal stress and sense of safety, but it could also be something like toxin exposures, drug exposures, moms being really sick. Like I've worked with some kiddos where moms had cancer when they were pregnant and didn't find out till after. So that's like a massive stressor on the body, and that's going to affect babies and their health and well-being after. The Moro is slightly different. I see a lot of kids who have more of those Moro characteristics where they're a little bit less intense. It's not quite such an extreme response, but still, a lot bigger than it should be. And the complications that we look at in pregnancy, they can be a little bit broader. Things like smoking, like chronic stress, all of the same traumatic things that we would look at for the fear paralysis, but it seems like it takes a little bit less for that. Um, or like the risk factors and complications can be a little bit less there. And it also can just be things like significant toxin exposure, and some of that may just be from living our normal life or from being in a house that has like extra mold or these other things. And then eventually, kind of the toxin load compounds, and babies can't cope and they're more sensitive to other things that happen later on. It's usually when I'm looking at these risk factors, it's kind of a cumulative effect.
Premature babies are particularly at risk for a retained fear paralysis reflex. Why is that, and what should NICU parents specifically be watching for as their baby grows?
Sure. So premature babies are at risk for a lot of different retained reflexes, including the fear paralysis. And there's a couple of different reasons for that. The first and most obvious one being that they aren't ready developmentally to be on the outside. Um, there is a lot that happens in the 9 months that we're pregnant. And so even babies that are a couple months early that aren't like these extreme preemies, there's a ton of nervous system and brain growth that happens towards the end of pregnancy that preps them for being outside of the womb. And when they are exposed to that, or when they're born early, their brains just aren't ready. And so much of what happens that gets them to that point is also kind of adding those compounding factors. So typically, when you look at a baby that's born early, they're more likely to have had pregnancy complications. They're more likely to be sick or growth restricted, or mom had a medical condition like preeclampsia where baby had to come out. They're more likely to be born by cesarean. They're more likely to have experienced birth trauma. So usually it's not just, oh, they're outside early. It's that they have all of these other things and they don't have the reserves and the resiliency to be less affected by those things. So they're more susceptible to those compounding factors. But I work with a lot of premature babies. We just have a lot of research and know that preemie babies tend to struggle with a lot of different things as they get older. There's a big connection between letting them stay in as long as we can, and their long-term development.
Yeah. My son was a preemie, so I know all about it.
I'm sure it's tough. So tough.
The list of symptoms for retained fear paralysis is long and intense: anxiety, perfectionism, elective mutism, OCD tendencies, separation anxiety, eating and sleep disorders, panic attacks, night terrors, fear of failure, fear of not being in control. How do you help parents see the through line connecting all of those to one reflex?
Sure. So when I am talking to parents about their kiddos, if they have a child that they're concerned about, I actually have them fill out this pretty in-depth questionnaire that asks about all of these risk factors from pregnancy, or basically from conception all the way through present day. So I'm trying to get like this big picture of what's going on with these kiddos, not just looking at the symptoms. Because it's true that you can have anxiety disorders like selective mutism or OCD that have any number of origins. So just because we have a diagnosis doesn't mean we have any information about the etiology or the origin of why those symptoms exist. And so for a lot of kids that I see, it's related to these early reflexes and this early development piece, but certainly not for all of them. So when I'm working with parents, I try to look through all of those factors so that we can get this big picture, so that I get more clues about their diagnosis, about their symptoms, and so that we can kind of talk about that child specifically. Because everybody's a little bit different, and sometimes we start talking and it becomes really obvious. It's like, yeah, they were born early, mom was sick, they were in the NICU, they were separated from mom, they had all these developmental delays. They needed help crawling, they needed help walking. All we can see this pattern of poor development that started prenatally. So we know, okay, the problem started here. So these are clearly areas and the time frame in which we need to start working. Other times it's a little bit less obvious, and so I'm looking for more specific clues that this might be connected to early development. And then obviously if I'm not sure, if it's hard to tell, then I have parents come in and we just do a screening where we test for a couple of reflexes to confirm and say like I'm suspicious that there might be a Moro, that there might be some vestibular stuff, but it's kind of hard to tell because this is not really a traditional kiddo that I see. So then we'll test those and we'll get a picture.
What does a retained fear paralysis reflex look like in babies and toddlers specifically, when the not wanting to be held, not tolerating swaddling, the freeze, then cry response to light and sounds, and what often gets misread as just a fussy baby or a high needs temperament?
Yeah, so this is a little tricky for me to answer. One, because I don't know, like I've been to tons and tons of births, spent a lot of time postpartum with newborn babies, and I don't know that I've ever seen one that I really thought like this kiddo has a fear paralysis and their Moro is not there.
Mm.
If we have a child like that they don't have their Moro reflex, they don't seem like they're neurologically intact, then we're going to be sending them in for a big eval. But sometimes those things are more subtle and they don't pop up until kids get a little bit older. But anytime you see babies that, or toddlers that kind of shut down from stimulus, where they like have more of the flat reactions to things, that's definitely a red flag. Physiologically, they might look calm on the outside, but physiologically that's not a normal response. There's a lot of chemical things that are going on internally that that kind of flat response is indicative of problems going on there. But again, I don't know that I can really point to a lot of obvious babies that I've seen with that response. Usually what you just see is more of the behavioral stuff where babies are really fussy, they're hard to soothe, they seem like they're stressed out, they don't settle well, or they're just like really flat and non-reactive. Both of those two things would be red flags in
Uh,
my mind.
all right, let's move on to the Moro reflex. It triggers your baby's very first breath at birth, the sudden change in temperature, the bright lights, the stimulation. Can you walk us through that moment and why it's such a remarkable piece of design?
Yes. So, this is so interesting. I mean, probably just because I'm a birth nerd and I like love birth and everything to do with it. But one of the things that people don't really realize is that babies, when they're in the womb, function very differently than they do when they're on the outside. Really, they rely on mom to take care of most of their needs. And then all of a sudden, they're on the outside and they have to take over those functions pretty much right away. They have like a very short transition window in which their whole body has to basically start functioning differently. And that process is jump started by their first breath. So as they take breath, their lungs inflate and it sets off this chemical reaction that changes a lot of different parts. It closes parts of their heart, it changes their circulatory system, it changes their acid base balances, it changes so many different things. And all of that is triggered by the Moro reflex. So they're born, they're exposed to gravity, they startle, their arms go out, they take a deep breath, and then it jump starts this transition, which is one of the most complicated, complex things that we ever do as people. We just don't think of it as being that difficult because babies usually do it pretty well on their own. They're kind of hardwired to do this well. But the thing that makes that work really well is that startle reflex and is them being very sensitive to that. And so you see babies are very sensitive to lots of things. There's a bright light in the room or a noise or you bump them and they just startle so easily. And that is very good for newborns. They need those like little jumps of adrenaline and cortisol. That helps to keep their arousal levels up. That helps remind them that they have a job to do. They can't just rely on mom to give them oxygen and food all the time anymore. And so it keeps their body functioning in this world. But that is not what we should keep forever. That is something that should integrate into a much more dynamic, much less sensitive response. We don't need that as we get older. We just need that for a very short period of time when babies are very small.
Hmm. The Moro is supposed to integrate around 2 months. What are the most common reasons it doesn't? And at what age should parents really start to be concerned?
Sure. Um, so the most common risk factors have to do with birth complications, then pregnancy complications, then early infancy complications. And I'm sure we're going to talk about complications more in depth later, so I will try not to do the whole episode right now. But basically, like anything traumatic that happens during that early stage is a risk factor. Things like head injuries, forceps and vacuum delivery, cesarean delivery, being separated from mom, being born early, stress in pregnancy, toxin exposure, all of these different things that are happening before that reflex integrates. Anytime the brain and body just feel chronically unsafe or they've had enough negative experiences or an experience that was negative enough, like it could be one single traumatic experience if it was intense enough. One of the ways that the brain can react to that is by holding on to these earlier survival responses. It's basically like, okay, this world is not safe enough for us to let go of this. We need this like really sensitive, really strong stress response to protect us. So, keeping your Moro reflex is actually a very healthy and adaptive response to an unsafe, unhealthy environment. The problem is that the brain doesn't know the difference between actually being in a dangerous, stressful situation and just being born by cesarean or having a head injury due to something like forceps or vacuum delivery. Like those things shouldn't set us up chronically. That's not something that's a one time thing that shouldn't prevent our brains from working right, but that doesn't always happen that way.
Yeah, last time when we did an Instagram live on this topic, I mentioned that my husband absolutely 100% does not have an integrated Moro reflex. And in the telling of his life when he was a baby, he had a allergic reaction back in the 60s to a shot, and it made his skin very raw, so he wasn't able to be handled. So a lot of times the Moro reflex is integrated by the picking up and putting down, this repetitive things that happens when you change a diaper, you go to feed, but he wasn't being handled because he couldn't be
Mhm.
handled. And so it never integrated in the way that it ought to have.
Yeah. Yeah, our brain develops based on movement and on experience and use. So if we don't move, we aren't handled, like you said, we don't move a lot, we don't interact with the environment in appropriate ways. It's stunts the way that our brain functions. And especially early on, when you're looking at these early reflexes, it's huge. I've worked with quite a few kids who were adopted who grew up over or who were born overseas and spent a lot of time in orphanages where they were really not handled very much, or they spent a lot of time in cribs or in confined in places and not moving. And that dramatically affects the way that their brain and body develops. They need a lot of support to kind of go back and give them those pieces that they missed during that time.
Wow. The retained Moro symptom list is huge: difficulty focusing, mood swings, anger triggers, sensitivity to fluorescent lights, hating tags and textures, difficulty with ball sports, motion sickness, food sensitivities, hyperactivity, followed by exhaustion. How does one reflex create such a sprawling set of issues across so many symptoms?
Well, I think the reason it might seem kind of crazy is if we look at it like, oh, it's just one little reflex. But the reality is it's one little reflex that tells us that that whole nervous system and our whole sense of stress and safety is not working right. So it's not just like, oh, you've got a little reflex that's interrupting how you function. It's like, no, no, you've got a whole nervous system that is functioning in this really like early early development survival mode, basically. They're kind of stuck in these early stages of development and they're kind of stuck in this survival mode. They're not like we get the best, most optimal development out of a sense of safety. So we have to like have the safety first, and then we can move into growing and thriving. But these kids are kind of stuck in survival mode. Their brain doesn't really realize that they are safe and they're in an environment where exploration and learning and play and all these other things can happen.
Mhm. The Moro reflex is directly connected to adrenal glands. Can you explain that connection and how chronic activation can lead to adrenal fatigue, asthma, allergies, autoimmune issues, and chronic illness?
Sure. So the reflex, like I said, is kind of the outward expression, but what we care about is what's going on internally. And what's happening is our sympathetic nervous system, that's like our fight or flight mode, is being activated, which comes alongside a lot of these like a lot of these chemical physiological reactions too. So we see things like adrenaline and noradrenaline spikes. We see things like elevated cortisol levels. Essentially, our body is just in this stress mode, and you live like that long enough, and it's going to affect all sorts of things. It can really affect the way the adrenal glands function. You can get kids that have like a lot of adrenal activity. It can get to a point where it kind of shuts down, and that doesn't function as well. Yeah, all of the physiological stuff is really the concern underneath the reflex that we're seeing.
So many of the symptoms of a retained Moro overlap with ADHD: distractibility, impulsivity, hyperactivity, emotional reactivity. In your practice, how often is what looks like ADHD or also a retained Moro reflex?
Sure. So the thing to understand about ADHD is this type of diagnosis is purely symptom based. So, if your kid has enough ADHD symptoms, then they qualify for the diagnosis. But, kind of like I mentioned before, it doesn't tell you anything about the etiology of why those symptoms are there. And they can be there for a lot of different reasons. The common one that I see is that it's often related to this Moro reflex and several other things too. Usually, I see a combination of problems. But when our stress response doesn't develop properly, it negatively impacts the way other parts of our brain develop. Specifically, most commonly in kids with ADHD, the way our arousal system develops and the way our executive functioning develops. So, when we're stressed, we tend to be hypervigilant. We tend to vacillate between hyperactivity and shutdown. We tend to struggle with things like impulse control and memory and planning and executive functioning because, again, our body is in this like survival type mode. It's more concerned about safety and not concerned about learning and attention and all of these other pieces that come later that are built on having a stable stress response. That piece comes first.
Hmm. A retained Moro can also drive that everything is a threat feeling, being easily startled, difficulty with criticism, controlling or manipulative behavior, low self esteem? How does living in a constantly triggered nervous system shape personality and relationships over time?
Yeah, I see a lot of different like personality type things, and it really varies depending on the kiddo. Some kids with this type of stress response tend to be more anxious and withdrawn and shy and reserved. They have more of that like fear withdraw response. Other kids have more of the outward focused, the aggressive. They get more of the fight response. So these are the kids that tend to be angry. They tend to have more physical outbursts. They tend to be more controlling of others. But essentially, it's just a- the kind of plethora of ways that a person can respond when they're threatened and they're not safe. And like I said, when you don't feel safe in your own body, it creates all sorts of problems and all sorts of presentations. Some kids I see both. They vacillate between being more withdrawn and being more aggressive. And it just kind of depends on the situation. But essentially, what's happening is that their little bodies and brains just don't feel safe. They're kind of in this heightened arousal state. They're trying to survive. They're just trying to function in a world that doesn't feel safe.
Hmm. When both fear paralysis and more are retained, which often happens together, what does that combined picture look like? And is one harder to integrate than the other?
Yeah, so usually, actually, when I suspect something like a fear paralysis, I actually don't typically see it alone. I usually always see signs of a Moro too, which may be why it's a little bit harder to test in babies and harder to pick apart. Because the Moro can kind of like override some of those things, but these things really kind of get mixed and blended together. But usually, what I'm seeing is kids that have like a really extreme more freeze response in certain situations, and then in other situations they might have a more mild Moro response, which is really funny to call a Moro a mild response because it's still way too intense or way more intense than it should be, but compared to this like really intense freeze response it does seem better. But usually the kids that I have worked with that I feel like have both, you see kind of a mix of those things. And really, we don't treat them separately. We treat the stress response kind of together as a whole. So if they have a really hyperactive freeze response, then the types of exercises and therapies and things that we do might look a little bit different. I always am way gentler and start kids off, and we start off very small and see how they tolerate it and build up, because usually if kids have a really sensitive freeze response, then they're going to be very sensitive to therapy too. We don't want to throw a bunch of stuff at them. It will make the problem way worse. So the biggest thing that I see with kids like that is that it usually takes a little bit longer. We have to be gentler and slower. And I usually incorporate a lot of other supportive things, like some built in connection time with mom, like some really calming activities and things that really help to kind of make their bodies feel safe throughout the day, not just when we're doing therapy. Um, so I don't necessarily think that it's harder. I mean, it's just slower. It's slower and we have to be gentler usually, but we can work through both.
What does the integration process look like with a child or an adult who has retained fear paralysis or Moro? How long does it typically take, and what kind of changes do families notice?
Yeah, it really varies from person to person. What I tell families when I'm consulting them is that on average, I work with kids for about 2 years to get through everything. And that includes all of the reflexes, the vestibular stuff, the vision stuff, kind of the whole thing. But some kids are fast. Some kids, it's like 9 months and we're done. Other kids, it's like, no, we're going to spend 5 years working with you because you have everything under the sun. And we have to be really slow and gentle. And they just react to everything. And we have to add in all sorts of additional help and support. So it's kind of a broad spectrum. Usually, the more sensitive kids are, the slower we have to start and the gentler we have to go, but also usually the bigger the progress we see because they have a lot further to go. So typically what I expect to see is I expect to start to see positive changes within the first 1 to 3 months, and to be totally done on average within 2 years. And usually what I see initially, especially if we're working on the fear paralysis or the Moro is like just a general calming down of a lot of the emotional side of things. So I see a lot of kids with really big feelings, really big reactions, really intense emotions, a lot of fear and anxiety, and difficulty communicating and engaging because of that. And so it's really common to see kids where their meltdowns decrease. They're sleeping better. They seem calmer and happier. They can communicate what they need rather than just like either shutting down and freezing or having these really intense feelings. So typically what we see first is kind of the social emotional stuff improve, and then usually what comes after that is going to be attention and academics, and then at the very very end executive functioning type things. Sometimes we see these things all kind of come together depending on the kiddo, but certainly social emotional comes first.
Awesome. For the parent listening who's realizing this is my child or this is me, what is the very first step they should take and what kinds of professionals should they be looking for?
Sure. So, if you want somebody who does reflex integration work, I strongly recommend finding somebody who went through the INPP program. That's the Institute of Neurophysiological Psychology. That school is based out of the UK. They are ones that have done some of the most research on it. They have the most robust program as far as like getting you accredited and getting people educated. They have the most continuing education requirements. And most of us who have gone through that are also participating in research and things like that too. So trying to keep it as professional as possible, um, and find somebody who does that and can really look at development through this kind of holistic lens where we can look at all of these factors of early development and make a plan for where to start. You can definitely reach out to me. I am connected to a lot of different people, so I can try to find you somebody in your area. If you're in the US, there's not a lot of us. If you're in Europe, you'll have better. You'll have more choices. Um, but there are some of us like me who will work with families remotely as well. So if there's nobody in your area and you're feeling stuck, you can reach out and I can either work with you or I can get you to somebody who can.
Fantastic. If a parent walks away with just one thing from this conversation about fear paralysis and Moro, what do you most want it to be?
Yeah, it's that I really want you to look at these reflexes as more than just a reflex. It's not just that they have this little funny thing that they do with their body that interrupts their day. It's that they really show us a bigger picture of what's going on internally, and the fact that their whole nervous system and stress response has not developed properly, and just to understand how many different areas that can impact, and knowing that we really, really want to get these kiddos to get their stress response and their nervous systems functioning optimally, that makes such a huge difference in so many areas of development and function.
Where can people find you, Early Roots and your podcast?
Sure. So, probably best would be Instagram or Facebook, which is at Early Roots. And then I have a ton of information on my website, and I just got it redesigned and updated. It just launched yesterday, so I'm so excited about it. It's got lots and lots of information about reflexes, about brain development, about symptoms. And on my website, you can also find connections to like my podcast and blog posts and things like that, where you can get more detailed information about specific topics.
Fantastic. Well, I don't know where the time went again. I always love our conversations. What blows me away every time we talk about these two reflexes is just how many of our modern struggles, the anxiety epidemic, the rise in ADHD diagnosis, the kids who can't handle the cafeteria or the school assembly or a seam on their sock, may be pointing to the nervous systems that never got the chance to feel safe in the first place. And most hopeful part is that it's never too late to do something about it. For listeners who want to dive deeper, we have full blog posts on both the fear paralysis and Moro reflexes at fledglingsflight.com, as well as Emily's site as well. And we also have infographics that show what to look for at home. Thank you for your time. I love our conversations.
Thank you so much for having me.
Thanks for tuning into A Parent's Guide to Child Development, where we decode milestones, demystify meltdowns, and occasionally question whether goldfish crackers count as a food group. Spoiler, they do. Make sure to follow us on Spotify and subscribe to our YouTube channel so you never miss an expert tip, breakthrough strategy, or aha moment that can make a big difference in your child's development. It's cheaper than therapy and less messy than glitter slime. We'll be back soon with more expert advice, real talk, and zero judgment. Until then, keep calm and try not to step on any Legos.